Hi, my name is Kirsty Troutman. I'm with the Reading Hospital School of Health Sciences for paramedic, class of 2013 to 2014, and today I'm going to teach you guys how to draw blood labs. Okay, so to get started, I'll tell you guys a little bit about what's in our lab bags. It comes in a bag like this. We have 5 different tubes that are always in this bag. We have a blue tube, 2 greens, a purple, and a yellow. And we also have spare tubes to the side. I'll explain what this is then. We also have a vacutainer as well as a hub. That is all in this bag. It's not mandated for pre-hospital use. Our community hospital allows us to draw labs for them prior to us bringing a patient in. Makes patient care go a lot faster, and it has labs already ready, so it makes everything go faster. So we'll get into explaining the tubes. Okay, so we're now going to go over what each blood tube means, the order we draw it in, and what they all do. So the first tube we're going to always draw is the blue. Then we have our 2 greens, a lavender, a gold, and any other tube after that. So first off, we have the light blue tube. That's used to determine coagulation. Our light green tubes are used for plasma. Lavender tubes are used for determining blood type for possible donors. The gold tube is used for infectious disease and also a routine blood donor screen. Why I have the gray tube out here, we use this for sepsis patient. It also is used for glucose determination. So we use that quite often. And when we ever use a green tube, I have an ice pack here just to show you that we always keep the gray tubes on ice per hospital request. Okay, so the last step that we have to putting together a vacutainer to draw the labs. In the kit, we have a vacutainer and a hub, and it's quite simple to put together. You just unscrew the white cap, and you stick the gray end into the vacutainer, screw it in, and pull the blue tab off. This will go directly into the catheter of your IV that is already started into the patient, and then you'll be ready to draw your labs. Okay, and next we're actually going to be drawing labs from a real patient. This is Danielle. So far we have a 20 gauge catheter already in her AC. We have the vacutainer and the hub all connected. And we also have our tourniquet still on to be able to draw the labs. Right now I have a little 2x2 here just to keep the area clean. And now we're going to be starting to draw our labs. Like I said before, we're going to draw with the first tube will be blue. We're just going to be sticking this in the vacutainer, pressing hard, and filling it up. Blue always needs to be fully filled. After every time you draw a lab tube, you're going to be shaking it back and forth. Next, we're going to draw one of our green tubes, and it's the same thing. We're going to be sticking it at the bottom of the vacutainer and clicking it in. These can be filled up halfway to a full way. Next, we're going to be drawing our green tube. And remember, we're going to be drawing 2 of these. You can fill these up halfway or full. Take it out of the hub and shake it back and forth. And next, we're going to be doing our lavender tube. Again, same thing. These can be filled up at least halfway. Pull it out and still shake it back and forth. And last, we have our gold tube, and of course it's the same thing that we've been doing, sticking it in the vacuum tube, filling it up at least halfway. And like I said before, if you have a sepsis patient and you need a gray tube, you will draw this the very last. You're going to want this entire blood tube filled. You're definitely going to want to shake this one. Take the tourniquet off the patient, and we'll be then sticking this on ice. Okay, last step is we're going to want to make sure all of our blood tubes go in this bag. So we're going to make sure they all go in. You're going to want to keep them with the patient. If you can label them before you get into the hospital. And also, we're going to need to put this gray tube on ice. So what we want to do is crack the ice pack, get tape ready, nice little trick is to put the tube in the bag and then fold it up. And this keeps it cold until we get into the hospital. And this is how you draw labs.